Hepatic cirrhosis. Cirrhosis of the liver is characterized by scarring. It is a chronic disease in which there has been diffuse destruction of and fibrotic regeneration of hepatic cells. As necrotic tissue is replaced by fibrotic tissue, normal liver structure and vasculature is altered, impairing blood and lymph flow, resulting in hepatic insufficiency and portal hypertension. Pathophysiology and etiology. Laennec cirrhosis, that is macronodular. Laennecs. Laennec. Fibrosis, mainly around central veins and portal areas. Cirrhosis most common because of chronic alcoholism and malnutrition. Second one, post-necrotic cirrhosis. Micronodular. Broad bands of scar tissue because of previous acute viral hepatitis or drug-induced massive hepatic necrosis. Third, biliary cirrhosis. Scarring around bile ducts and lobes of the liver results from chronic biliary obstruction and infection, that is cholangitis. Much rarer than Laennec and post-necrotic cirrhosis. Clinical manifestations. Onset is insidious, may take years to develop. Early complaints include fatigue, anorexia, edema of the ankles in the evening, epistaxis and bleeding gums, and weight loss. Later complaints because of chronic failure of the liver and obstruction of portal circulation. Chronic dyspepsia, constipation or diarrhea, esophageal varices, dilated cutaneous veins around the umbilicus, that is caput medusa, internal hemorrhoids, ascites, splenomegaly and pancytopenia. Plasma albumin is reduced, leading to edema and contributing to ascites. Anemia and poor nutrition lead to fatigue and weakness, wasting and depression. Deterioration of mental function from lethargy to delirium to coma and eventual death. Estrogen androgen imbalance cause spider angiomata and palmar erythema, menstrual irregularities in females, testicular and prostatic atrophy, gynecomastia, loss of libido and impotence in males. Bleeding tendencies such as nosebleeds, easy bruising, hematemesis or profuse hemorrhage from stomach and esophageal varices. Diagnostic evaluation. Number 1, liver biopsy detects destruction and fibrosis of hepatic tissue. Number 2, liver scan shows abnormal thickening and the liver mass. Number 3, computer tomography CT scan determines the size of the liver and its irregular nodular surface. Number 4, esophagoscopy to determine esophageal varices. Number 5, paracentesis to examine ascitic fluid for cell, protein and bacterial counts. Number 6, PTC differentiates extrahepatic from intrahepatic obstructive jaundice. Number 7, laparoscopy and liver biopsy permit direct visualization of the liver. Number 8, serum liver function test results are elevated. Management. Minimize further deterioration of liver function through the withdrawal of toxic substances, alcohol and drugs. Correction of nutritional deficiencies with vitamins and nutritional supplements and a high calorie and moderate to high protein diet. Treatment of ascites and fluid and electrolyte imbalance. Restrict sodium and water intake depending on amount of fluid retention. Bed rest to aid in diuresis. Diuretic therapy frequently with spironolactone, aldactone, a potassium sparing diuretic that inhibits the action of aldosterone on the kidneys. Abdominal paracentesis to remove fluid and relieve symptoms. Ascitic fluid may be ultrafiltrated and reinfused through a central venous access. Administration of albumin to maintain osmotic pressure. And peritoneous shunt. Peritoneovenous shunt may be performed in patients whose ascites or resistant to other forms of treatment. Complications include bacterial infections, shunt obstruction, and intravascular coagulopathies. Symptomatic relief measures such as pain medication and antiemetics. Treatment of other problems associated with liver failure. Administration of lactose, neomycin for hepatic encephalopathy. Orthotopic liver transplantation may be necessary. Complications: hyponatremia and water retention, bleeding esophageal varices, coagulopathies, spontaneous bacterial peritonitis, hepatic encephalopathy, which may be precipitated by the use of sedatives, high protein diet, sepsis, or electrolyte imbalance. Thank you.